Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 5 starts now.
It is getting better, but the state's chief medical officer says we are not out of the woods. Now, Governor Whitmer says Michigan's stay-at-home order will likely need a short-term extension, though she is not giving specifics just yet. Glad you're with us for Local 4 News at 5. Those comments came a short time ago at the governor's news conference this afternoon.
So let's get right to the headlines today. There were 999 new cases and 113 new deaths in the past 24 hours. Also, Mayor Mike Duggan today said he believes this year's Ford fireworks set for June will at the very least need to be postponed.
But all the focus right now on the governor's comments about extending the stay-at-home order. So let's get to Rod Maloney live tonight. Rod, she says the state's getting closer to loosening some restrictions.
Well, and she's been saying that for the last few days, Devin. A little bit cagey about this, promising this week we'd hear something, and now she's saying it could be next week. But she did say Friday is going to be an important part of this equation.
I'm hoping to say more when we can start loosening restrictions as soon as Friday of this week. I'll continue this conversation and share more information. I want to be clear, we will likely need another short-term extension of the stay home, stay safe order.
The governor this afternoon parceling out her thoughts on reopening the state. She's acknowledging the curve is flattening. That means we can start hoping for reduced restrictions, and she knows there are many in Michigan anxious to get back to business.
As hard as this is right now, a second wave would be devastating. So when I say I'm hoping to loosen some restrictions, I mean that I'll only loosen them based on what the facts and data are telling us when it is safe and how it is safe to do so.
She's dropped hints over the last few days. She wants a layered approach to a reopening, appears willing to do so regionally. One of the things that she gave specifics on is that the stay-at-home order is going to stay on for the state's most vulnerable.
For the near future, we know that it's not going to be safe for especially vulnerable population to be out and about publicly. And so people who have COPD, people who are over the age of 65 are going to have to continue to stay at home.
Now, who's she working with here? Well, it's the Republican legislature. I reached out to the Speaker's office this afternoon. They didn't have anything to say about what she said today because she really didn't lay out much, but they are talking, and there is belief that they can find a middle ground here so that April 30th doesn't have to be a Donnybrook, but we'll have to wait and see on that. Devin, back to you.
Rod, she did have just a few comments about businesses and which ones can expect this to last longer for them.
Right, and the one she did say on MSNBC last night that it's the businesses where you're going to be closest to people, salons, massage parlors, movie theaters, and that kind of thing. They're going to have to wait a long while, and so we've gone and talked to one of those business owners to get their reaction to that. We'll have it on Local 4 News at 6.
You bet. All right, Rod, we'll see you then. Now, tonight we're also getting new information about just how long the coronavirus may have been silently spreading in the United States.
Right, Devin. Health officials in California now say the first U.S. coronavirus deaths actually occurred weeks before previously thought. Our Dr. Frank McGeorge joins us live to break down the new timeline. And Frank, I guess this comes as no surprise to doctors.
No, not at all. In fact, many doctors, myself included, had patients earlier on that we believed were COVID-19 cases, but they didn't qualify for testing because they either didn't have a history of travel to China or they didn't have the required symptoms for testing of fever, cough, and shortness of breath. But now there is concrete proof that the timeline of cases actually started much earlier.
The first confirmed case of coronavirus in the United States came on January 21st in a man from Washington state who developed symptoms after returning from a trip to Wuhan, China. But the first confirmed U.S. death was thought to be more than a month later, on February 29th in Kirkland, Washington. Health officials there later found 2 deaths on February 26th were also due to the virus, pushing the timeline back 3 days. But coroners across the country are now looking back at other deaths. The medical examiner in Santa Clara County, California, sent tissue samples collected during autopsies performed in February to the CDC for testing. Samples taken from patients who died at home on February 6th and 17th both tested positive for the coronavirus. That pushes the fatality timeline back 20 days. Health officials believe the patients were infected in the community. Neither is known to have had a travel history. Given that deaths tend to lag infections by about 2 weeks, the first patient could have been infected in mid-January. It's now likely that the coronavirus was already spreading in the U.S. far earlier than reported, hidden in a bad flu season and undetected by rigid testing rules. Yeah, and as one health official described it, COVID-19 deaths really just represent the tip of the iceberg in terms of total infections. For every death, there could be 50 to 100 infections in the community or more. Because of the limited testing that has been done, we don't know how big that iceberg is, but we know for certain that did strike us weeks earlier than previously thought.
So are you saying that you think this timeline could shift even farther back as more deaths are reviewed, Doc?
Well, as the whole situation unfolds, I think that is absolutely possible, and it might turn out that many more people who were thought to have the flu or some other virus in January and February may have actually had COVID-19. Now, that's, of course, much more difficult to determine, but it could have an impact on how many people ultimately have some antibodies against this virus moving forward, because they may have been unknowingly infected in those early days.
Right. I know a lot of people are wondering that exact same thing. Okay. Thanks, Doc. Well, nursing homes remain a top priority in the fight to stop the spread of COVID-19, especially in Detroit.
Yeah, tonight, Mayor Duggan touting the success of testing inside Detroit nursing homes to help get cases under control. But where else are we seeing the coronavirus in nursing homes? Defender Karen Drew takes a look at what's happening in counties across Metro Detroit.
Mayor Duggan says all seniors inside nursing homes in Detroit will be tested for COVID-19 by the end of tomorrow. Then the testing will continue in long-term care and assisted living homes.
Outside a nursing home on East Grand Boulevard in Detroit, members of the Detroit Health Department, Henry Ford clinicians, suit up in protective gear to go inside. The team is testing seniors and staff for COVID-19.
We now have tested 3/4 of the residents of our nursing homes. They are coming back 25% positive.
The city running tests in 21 of its 26 nursing homes, 357 confirmed COVID-19 cases, 129 deaths.
We will be through every nursing home resident by the end of the day tomorrow with our 15-minute tests. We are seeing the nursing homes do what we had hoped, setting up separate COVID-19 areas, isolating patients the way they should.
Testing is vital, along with PPE and staffing.
The Local 4 defenders learning the Centers for Disease Control workers already doing nursing home visits and checking out testing in Detroit.
We are going to go in order where the science tells us to go. So the places at which the spread is occurring greatest, we're going to go in that order.
This is what the defenders have learned about cases across Metro Detroit. Oakland County has just over 200 nursing home and rehab facilities. So far, 127 have positive cases. 1,038 people, both staff and residents, testing positive for COVID-19. 146 people have died. Macomb County has 77 long-term care facilities. 46 of them have COVID-19 cases, with 332 people testing positive for coronavirus. 128 of them have died.
Wayne County has been unable to provide the defenders with its nursing home numbers. We are still trying to get those answers for you. We will stay on top of it. I'm Karen Drew, Local 4 Defenders. Back to you.
All right, Karen, states are beginning to step toward reopening their economies, at least in a partial way. Some businesses already opening this week. Alice Barr in Washington tonight, though, as there are deep concerns about moving too quickly, Alice.
Devin, 3 southern states announced plans this week to begin reopening, among them Georgia, where some mayors are pushing back, saying they haven't met the White House guidelines for reducing cases before opening businesses like barbershops and gyms.
With pressure mounting to get the economy going, South Carolina is reopening some businesses today. Georgia preparing to do the same on Friday, amid concerns they're not taking proper steps to prevent new coronavirus outbreaks.
Reopening without full knowledge of how many cases you have is basically Russian roulette with people's lives.
Other states are wrestling with their own plans to open back up, as health experts warn a second wave of cases could coincide with flu season at the end of the year and hit even harder And while the first U.S. deaths from the virus were believed to be in Washington state in late February, officials now say 2 people died in California weeks earlier. That raises new questions about how long the virus has been here and underscores the need for widespread testing, though the former head of the CDC warns that's just one piece of the puzzle.
Unless you isolate people who test positive, trace their contacts, and quarantine their contacts, you box it in, we're really not getting the benefit of testing.
New York's governor announcing today former Mayor Michael Bloomberg will help develop and fund the state's testing program, including training thousands of workers to trace contacts of the infected.
We have to expand this number tenfold and get this all done like this.
President Trump pressing ahead with his plans to sign an executive order today banning most green card immigration for the next 60 days, he says to protect American jobs. But the order isn't as wide-reaching as he originally made it seem, because farmers and other businesses that can't survive without foreign labor demanded exemptions.
And while the House prepares to vote tomorrow on nearly $500 billion in emergency aid for small businesses, hospitals, and testing, state and local government leaders are clamoring for federal assistance as they try to fight the virus with their normal revenue streams running dry. In Washington, Alice Barr, Local 4.
Yeah, all right, Alice. Meanwhile, stocks snapped a 2-day losing streak today. The Dow finishing up 457 points. Both the S&P 500 and the NASDAQ closed up 2% on the day.
Well, we are in the middle of April, and Mother Nature is throwing everything at us all at once, it seems. Hi, Ben.
Yeah, Kim, snow's coming down really good in parts of the area right now. That will eventually become rain, but how much are we going to end up with before that transition happens? We'll look at that next.
Families protest outside the Rivergate Nursing Home in Riverview. We'll speak to a family about why they're out here today.
I'm Hank Winchester. Help me, Hank. I'm hearing from so many of you with concerns about how to file for unemployment and all the glitches. Well, now we are getting your most common questions answered. We're live after the break.